So a pterygium is essentially a growth that occurs across the surface of the eye. And these are actually quite common growths that we find here in Australia, where we have a lot of UV exposure from the sun. It's often called the surface eye because it's often seen in individuals that do a lot of surfing in the ocean. What happens with the pterygium is that you get this growth growing across the cornea, and this can actually damage the vision as it gets close to the pupil margin and into the visual axis of the patient. The way we treat pterygium surgery these days is to remove it, and most surgeons will recommend the patient receive an autograft, which is a little bit of tissue from the surface of the eye, and that reduces the risk of the pterygium coming back by a factor of 97%. One of the newer techniques in pterygium surgery is to apply the little graft on the eye with tissue glue, with a special type of glue that we use in the operating theatre, and that minimizes post-operative discomfort because we don't have to perform any stitching on the surface of the eye. And the cosmetic result is actually very, very good. I have been performing this technique over a few years now, and I'm very happy with the results. The risk of pterygium surgery is actually very, very low because it's a procedure that involves treating the surface of the eye. So we don't actually enter the eye. We simply clean that area on the surface of the eye. And like most medical procedures, there's a very small risk of infection or bleeding, but we do give patients antibiotics for a few days, and that helps to settle the eye down. The best time to have a pterygium removed is when the pterygium is showing signs of growth across the cornea. And patients are able to see that. They examine themselves in the mirror, they can actually see a white spot forming and developing on the cornea. Some patients complain that they've got a gritty eye, an uncomfortable eye, or that they have individuals, friends making a comment about what is that spot on your eye. And that's the best time really to intervene medically and have the pterygium removed.